Hello, and welcome to Lead Center's webinar on WIOA, the Workforce Innovation and Opportunity Act, Section 188, statewide cross-systems training, broadening access to all customers, including people with disabilities. For those of you who are new to the Lead Center, LEAD is the WIOA Policy Development Center. LEAD stands for Leadership for the Employment and Economic Advancement of People with Disabilities. The LEAD Center is led by Social Policy Research Associates and National Disability Institute, and is funded by the Office of Disability the Office of Disability Employment Policy at the U.S. Department of Labor. These slides and a recording and transcript of this webinar will be posted on the LEAD Center's website at www.leadcenter.org. These products have been funded either wholly or in part with federal funds from the U.S. Department of Labor's Office of Disability Employment Policy. The contents of this publication do not necessarily reflect the views or policies of the Department of Labor, nor does a mention of trade names, commercial products, or organizations imply endorsement of same by the U.S. government. Recipients should review the Civil Rights Center's web materials and 29 CFR Part 38 to better understand their legal obligations. I am Rebecca Salon. I'm co-project director of the LEAD Center. I work at National Disability Institute, and I will be moderating today's session so that you can all fully participate in today's webinar. We wanted to share some additional information. The session is being live captioned. Use the controls above the captioning stream to adjust font and sizing. Use the scroll arrows to review earlier content. We encourage you to ask questions, and there will be time at the end for questions and answers. If you have questions during the presentation, please type them into the chat pod below the slides. If you're experiencing any technical issues or have questions for the technical support team, use the controls in the upper ribbon to raise your hand. I'm very pleased to introduce Melissa Turner. Melissa Turner is the Director of Special Projects in the Office of the Assistant Secretary at the Department of Labor's Office of Disability Employment Policy. She previously worked on ODEP's employer policy team, leading work with employers to increase recruitment, hiring, retention, and promotion of individuals with disabilities in the workplace. Melissa also has experience in the Office of Management and Budget, OMB, analyzing education and disability budget, policy, legislative, and regulatory proposals for the U.S. Department of Education. While at OMB, she developed regulations to protect the rights of individuals with disabilities under the Workforce Innovation and Opportunity Act, WIOA, and the Individuals with Disabilities Education Act, IDEA. Prior to her role at OMB, Melissa worked at the U.S. Department of Education's Office of Special Education Programs, providing technical assistance to state special education and general education programs to improve results for children with disabilities. Melissa, we welcome you to the webinar, and please take it.
Thank you for that introduction, Rebecca. Good afternoon, everyone, and welcome to the webinar, Statewide Cross-System Training on WIOA Section 188, Broadening Access for People with Disabilities and Other Barriers to Employment. I'm Melissa Turner from the U.S. Department of Labor's Office of Disability Employment Policy. I hope that you and your families are staying safe and healthy at this time. ODEP and the U.S. Department of Labor understand the many ways that Americans are adjusting their daily lives to ensure healthy communities during the COVID-19 pandemic. ODEP and its technical assistance centers have created resources to help individuals and families during this time, and I urge you to check out our website at www.dol.gov/ODEP to learn more. ODEP funds the LEAD Center, which is hosting today's webinar and gathered today's excellent group of speakers. During this webinar, we will be joined by speakers from Virginia's Equal Opportunity Office, WIOA Adult and Dislocated Worker Programs, and Department for Aging and Rehabilitative Services, who will share approaches in how to effectively engage workforce staff and partners across all 4 WIOA titles to implement equal opportunity access. I also want to take this opportunity to let you know about an important anniversary that is happening this year. ODEP is working on a series of events and resources to commemorate the 30th anniversary of the Americans with Disabilities Act, or ADA, which was signed into law in July of 1990. The ADA is a civil rights law that prohibits discrimination against individuals with disabilities in all areas of public life. Its purpose is to make sure that people with disabilities have the same rights and opportunities as everyone else. And now, more than ever, this couldn't be more important. We invite you to learn more about the ADA during this important year. With that, I will turn it back over to Rebecca and the rest of our speakers to tell us more about Section 188 of WIOA and how you can best support workers with disabilities in your state.
Thank you so much, Melissa. We just wanted to review the objectives of today's webinar. During this webinar, you will have a chance to review WIOA Section 188 with a focus on programmatic access and reasonable accommodations. You will learn how to gain essential cross-title and cross-system supports and partnerships to implement effective equal opportunity policies and practices, and learn about Section 188 training approaches implemented statewide in Virginia, including current EO scenarios and solutions. We have a wonderful set of speakers today. We're very excited with the information that they'll be able to share. To get started, I want to introduce our speakers to you for today. These 4 speakers have leadership and on-the-ground experience and expertise that they bring to this webinar. Jamie Robinson is a financial empowerment and workforce manager and a member of the National Training and Technical Assistance Team at National Disability Institute. Jamie specializes in workforce systems change with a focus on integrating equal opportunity and financial capability strategies into service delivery systems. And she's worked for several years with the other presenters from Virginia. Sinclair Hubbard works for the Virginia Department for Aging and Rehabilitative Services, also known as DARS, as the WIOA manager and Disability Employment Initiative lead. Sinclair has been the project lead for 3 rounds of the Department of Labor's Disability Employment Initiative, implemented by Virginia's WIOA Titles 1 and 4. In addition, she's responsible for the statewide VR partner Memoranda of Understanding and AJC cost allocation plans with local workforce areas. Constance Green is the Virginia WIOA Adult and Dislocated Worker Programs State Coordinator. Constance is responsible for developing policies and providing guidance and technical assistance to the one-stop system partners on Title I adult and dislocated worker activities, as well as staffing Virginia's Accessibility Task Force, which you'll hear about today. Dr. Sylvia Berry is Virginia's Equal Employment Opportunity Specialist. Dr. Berry is responsible for investigating internal and external charges of discrimination. She also assists in administering the agency's statewide human relations program, serves as the agency ADA coordinator, and assists in developing training products and services. And with that, I would like to turn this over to Jamie Robinson.
Great. Thanks so much, Rebecca. And hello, everyone. It's really good to be with you all today. I'm going to review some of the key elements of WIOA Section 188 so we can kind of all get on the same page. And then I'm going to pass it over to the Virginia team. They will have a little bit more exciting information about the strategies, the practices they're using to not only meet 188 compliance, but to expand partnerships, to improve accessibility, and the ultimate goal to increase employment for people with disabilities. So Section 188 of WIOA implements the non-discrimination and equal opportunity provisions for workforce services activities and programs across all of these diversity bases, including race, color, religion, sex, which also includes pregnancy, childbirth, related medical conditions, transgender status, and gender identity. It includes age, disability, political affiliation or belief, national origin, including limited English proficiency, and citizenship status. So here is the link. You can go to it and reference all of today's information, and we encourage you to do so. And okay, so under Section 188, AJC programs are required to provide reasonable accommodations for individuals with disabilities to ensure equal access and opportunity. And reasonable accommodation is defined as a modification or adjustment in the way a program is administered that enables an individual with a disability to receive any aid, benefit, service, training, or employment equal to those provided to individuals without disabilities. So a job seeker who voluntarily discloses a disability in that AJC will want to work together to identify if any reasonable accommodations are needed, and also, if they are, to implement it as quickly as possible to avoid delaying access to services. And this is why it's really important for AJCs to not only have the written policies that explain those obligations, but really important that both staff, AJCs, and customers understand the processes of implementing those solutions. So an example of an AJC having both policy and processes in place could be a deaf customer requesting a sign language interpreter. If that AJC has a plan of action to secure that qualified interpreter, they know who to contact, they know how they're going to pay for it. The customer's access is likely, going to keep on moving, right? It's not going to be delayed. But if an AJC has an accommodation policy, which we know they all do, right, but they don't have the processes to operationalize it, that could delay the accommodation and the services. And we could miss out on working with that customer too. In limited circumstances, the AJC programs may not be required to provide a reasonable accommodation if it can establish that doing so would cause undue hardship. Kind of keep in mind there, limited circumstances is important, but accommodations are going to depend on each situation. Let's kind of take the same example of the deaf individual and assume the AJC did provide the interpreter. And then that individual was deemed eligible for a training program, which is months long, right? So who provides the interpreter then? Well, you really have to look at each situation individually, lots of different factors. Maybe the person doesn't need an interpreter for the whole training, right? But if kind of this concept of undue hardship may come up, there are other ways to work with it or work around it. This could be a good opportunity for the AJC and the training provider to provide partner actually with VR if the customer were to also choose that option and agree to it, to leverage costs of the interpreter throughout the training program. So this is a situation I've experienced myself, and I've also seen it happen in the field with people with all kinds of disabilities, and that this kind of collaboration can be successful. So really important to explore the different options, different partnerships, especially when a cost of an accommodation might seem a little high. So who does Section 188 apply to? Well, recipients are defined as any entity to which financial assistance under WIOA Title I is extended. And you can kind of read there where many of you fit into a lot of those categories. Point out a few: one-stop operators, job centers, service providers, including eligible training providers. That's important. OJT employers. The last bullet, too, programs and activities that are part of the one-stop delivery system that are operated by one-stop partners. Well, that's important because any program or activity that touches the AJC is going to have an awareness of Section 188 non-discrimination regs and equal opportunity practices. And that then typically falls on workforce staff and EO officers to help educate those partners and programs, including the training providers or employers. If you haven't heard of this resource yet, I highly recommend it. It's pretty invaluable. It's called the Promising Practices in Achieving Non-Discrimination and Equal Opportunity, a Section 188 Disability Reference Guide. And if you want to understand more about 188 in terms of everyday practices beyond compliance, which is important, but it's also about what's the effectiveness, how is it working. This is really an incredible resource. The guide was jointly developed by the Civil Rights Center, Office of Disability Employment Policy, with support and assistance from the LEAD Center. And the promising practices in the guide directly correlate with the non-discrimination equal opportunity requirements of Section 188. So you basically just have a lot of different examples, a lot of approaches, a lot of different strategies of how you can comply with Section 188 and how you can ensure access. Also important to note, the guide does not create any new legal requirements or change any current legal requirements. The promising practices that are in this guide do not preclude you all from devising alternative approaches. We know you are. We hope you are. Hopefully we'll learn about them and add to this guide in the future. And adoption of promising practices, of course, won't guarantee compliance, right? But what we do know is that the examples and the strategies in this guide really highlight what's working across the country. So I definitely recommend everyone to check this resource out. So within this guide, you're going to see many examples of how WIOA programs and partners can work to ensure equal access to services. And under each of the bullets on this slide, which are emphasized, these are really emphasized in 188 and the guide, you're going to find a variety of strategies from workforce systems across the country. So for example, under how to prohibit discrimination against people with disabilities, you're going to find all different training approaches for AJCs that help to reduce bias or stereotyping of people with disabilities. In providing reasonable accommodations, you'll find strategies that AJCs and their partners are using from the point of somebody walking in the door to registration to assessment, excuse me, to providing accommodations throughout the entire customer flow of service delivery. And it's actually broken down like that in the guide. Excuse me. You'll also learn how workforce systems are ensuring the same processes for all customers in programs. So examples on how are some AJCs making sure that people aren't being screened out of programs. That's really layered, right? And you can read about that. Learn how your AJCs are administering programs in the most integrated settings for individuals with disabilities. And what does that mean? Well, it can mean working to ensure that job seekers with disabilities are not automatically referred to your state vocational rehabilitation programs, right? And that choice of the customer is at the forefront. And how do you do that? How do you help people connect with VR if that's something that might work for them, but not make it an automatic referral, right? You can also review practices that ensure effective communication. And that can start with AJCs understanding that phrase that's on all of their forms. We provide auxiliary aids upon request. What does that mean? And learning what other AJCs are doing to train staff on what that does mean. It may mean knowing the availability of assistive technology, knowing that you have closed captioning on all your videos for your workshops, knowing you have a process in place to secure ASL interpreters, right? So understanding your policies to practice. And then also you will find examples on, how to make programs programmatically, physically accessible. What does that mean? And examples of how AJCs are partnering, co-enrolling customers. What does that look like? Leveraging expertise from partners in the community. Lots of examples on these emphasized points that can kind of help you understand what's behind them. So as we talk about equal access today under 188, just kind of important to keep in mind that WIOA aligns these 4 core programs to provide a coordinated and comprehensive approach and services. So I'm sure you're all familiar with these 4 titles, but you're going to hear from Virginia on how they're coordinating their training efforts for the first time across all core partners, 1, 2, 3, and 4, and what that has meant to their state. Also bring in their required partners, also their disability expertise, because it's really made a big impact on how they're all serving people with disabilities. So we know from states like Virginia that this coordinated approach under WIOA offers this really vital opportunity for all core partners to look closer at accessibility and have a chance to improve it under 188 through AJC certification. So local workforce development boards must follow procedures and criteria that's established by their state to certify AJCs and their network at least once every 3 years. Some states opt to certify every year, every 2 years, but you must do it once every 3. And that includes comprehensive and affiliate job centers. And the criteria must evaluate, among many other things that are evaluated under AJC certification, physical and programmatic accessibility, including communication access in accordance with Section 188. So many states will often use a type of checklist to evaluate physical accessibility. And that might work because there are a lot of measurements and things involved with physical access, but programmatic access can be a little bit more layered, right? So this is kind of where consultation with your state, your regional, your national projects, your partners, experts, you can bring in. And also looking at your customer experience here of how are people experiencing access in their programs here, and how are partners, disability partners, experiencing collaboration. So with AJC certification, it's really kind of pulling in the partners to have a much closer look than ever before at programmatic access. And here you have the definitions that we've been talking about all along here. And all of these areas are also in the guide, many different examples of what does this mean? How can we get there? How can we achieve compliance? How can we boost access? I want to highlight the 4th bullet here, providing appropriate auxiliary aids and services, including assistive technology, where necessary to afford individuals with disabilities equal opportunity to participate in and enjoy the benefits of the program or activity. So not just getting in the door, right? Not just, okay, got in the door, all right, I got to the activity, I got to the program, but enjoying the benefits. So you can kind of find what would that mean to you, right? But for some, it could mean reaching their goals, acquiring skills, being able to get employed after, right? So it's not, it's really, this is something I talk to One Stop about a lot, that access, not just for the sake of access, but how can we ensure that people with disabilities, all different kind of disabilities, are reaching, getting through the program and reaching their end goal, right? And this definition is different than the similar term program accessibility in the ADA Title II, which refers to accessibility of facilities, programs, services, technology, materials for individuals with disabilities. Programmatic accessibility is actually a WIOA term. It's more encompassing. It requires One Stop to ensure equal access for people with disabilities from policy to practice. So I'm about to hand it over to the Virginia team. I just want to mention a few areas that they're going to expand upon that I've had the opportunity to experience firsthand over the years. The first is they have a pretty incredible accessibility task force. I've never really seen anything like this before in terms of the diversity of partnership. It is cross-title. It is cross-system. They have representation from the Commission for the Blind. They have representation from Deaf Services, Centers for Independent Living, Voc Rehab, Equal Opportunity. Everybody's at the table. And it's just a level of collaboration. It's very challenging, right? Because you have so many systems at the table. You have so many perspectives. And remember, a lot of the disability, those agencies, they're not as familiar with the workforce centers and how they work. So there's just a lot of cross-education that really has to happen. But this table has really become representative of the people that they're serving, which is so beneficial. So they're going to talk a little bit more about that. The second bullet here is the partnership that the Virginia Centers for Independent Living have formed. They have really taken on a leadership role with the AJC certification. And if you're not familiar with CILS, they are fierce disability advocates, and I mean that in a positive way. And they're a partner that you want on your side to strengthen accessibility. You definitely want them on your side, and Virginia has formed that partnership. The third here is leveraging the Disability Employment Initiative, the DEI. If you were a DEI region, you know how impactful disability resource coordinators have been in the workforce system. I mean, they have been incredible partnership builders, system change agents, advocates, implementers. I mean, it just makes sense that, and I'll say the first time I went to their accessibility committee, DEI wasn't there. And a few of us were like, where's DEI? They have to be here. And so we brought them to the table. So these are kinds of all the partners that can work together. And then finally, you'll hear more on their training efforts, which LEAD is a part of. And basically, this training largely centers on scenarios that AJC and other partners are experiencing with customers with disabilities, with other challenges. And we're kind of giving them an interactive, safe forum for discussing these things and trying to talk about how do we move forward with this? How do we become empowered to implement accommodations or reach out to partners? And part of that is educating the management and the leadership on that. And they've been very responsive. So with that, I am going to turn it over to Constance Green to share some more details. I got you started, Constance, on a few of those points, but I'm going to hand it to you.
Thank you, Jamie. Hopefully everyone can hear me now. And as Jamie had mentioned, our approach in Virginia to Section 188 has been driven by collaboration across multiple points. Specifically, Virginia's Accessibility Task Force has been an integral part of developing the key strategies and actions that are moving Virginia beyond a compliance is enough mindset The task force, as Jamie mentioned, includes members from all 4 of the standard titles for WIOA, plus we've included our Department of Social Services, our local workforce board directors, local workforce provider staff members, state-level EO officers, and departments for deaf and hard of hearing and blind and visually impaired. And most interestingly for us was that collaboration and inclusion of our Centers for Independent Living on our state task force. The primary tenet of the task force principles is that the access to AJCs is everyone's responsibility and access to AJCs is for everyone. This means that access is about individual engagement and responsibility across all levels of the workforce system staff, and that access is for individuals of all abilities in Virginia. So that's a pretty all-encompassing perspective. But in reality, in Virginia, we've found that WIOA has provided opportunities for all of our titles to increase access through a joint effort. Our traditional silos have been set aside through the work of the task force, where our team has collectively provided guidance. It's contributed to state workforce board policies. They've played an active implementation role in the AJC certification process, and they've led the charge for statewide training efforts in support of Section 188 implementation. We've also continued to build on our strong history of collaboration and leadership at the state and local levels, especially through multiple rounds of DEI funding, which we'll talk about a little bit more. Next slide, please. Thank you. So, one key to our success in Virginia is that we have created an action-oriented accessibility task force. The task force has set out a plan that includes targeted actions in several areas such as policies and processes, training, and communications. And these are not just for the AJCs, it's for all the members involved plus the AJCs. As we accomplish our objectives, we're coming back together to develop new objectives to keep that ball rolling. And while we started off with compliance in mind, we really have been able to move much further into programmatic accessibility through participating in that AJC certification process along with other opportunities. One reason that our action-oriented approach has been so effective is that we've leveraged diverse cross-partner expertise to provide critical technical assistance. The diversity of knowledge areas and the depth of the knowledge within the partnership of the task force has allowed us to pinpoint technical assistance to the local level in a way that fosters long-term local-to-local level partner relationships. So the secret to that connection is the network of partnerships that are developed that last beyond the task force members that do the facilitation. For example, when conducting our AJC certification site visits, the multi-partner team from the task force was able to answer some highly specific technical questions and then make warm handoffs to their local agency counterparts for the future AJC staff needs. So those are networking and relationship building activities that will outlast the members of the task force. A final key strategy from our experience in Virginia is that combining a policy perspective with practical application will result in positive outcomes. Having policy people like myself, for example, engaged with and educated by diverse subject matter experts has meant better policy support for useful strategies and actions that drive employment outcomes for customers of all abilities. So with that, I will now turn it over to Sinclair to speak specifically about Virginia's Section 188 training approach.
Thank you, Constance. Hello, everyone. I just want to give you a little background that Virginia has been working with the LEAD Center, now the WIOA Policy Development Center, to bring us technical assistance and training through our Department of Labor Workforce Disability Grants for over 15 years. And these initiatives have focused on making our career centers fully accessible and for folks with disabilities. Now, Constance just talked about that accessibility task force. It actually was originated by both Titles I and Title IV. So you had the adult dislocated worker and the VR folks getting together, and they strategically invited all workforce partners to the discussion. So how did we get to these trainings and this strategy of our trainings today? Well, our Accessibility Task Force also includes a representative from the Workforce Development Board Directors Association. And we were in a session with Jamie several years ago and talking about training needs for staff and how to deliver training. And this director was very targeted in her recommendation that all of our trainings coming from the task force and coming out to the local areas had to be cross-partner trainings. Otherwise, she said, it would just be the same old silo trainings for each agency. So that director was heard, and here we are today. Last year, we were invited by our 2 equal opportunity officers at the state level to participate in a statewide conference, and we invited Constance, and they also said they wanted the lead center to present at that conference. So Jamie came in and presented with us at that conference. What was interesting was the scenarios that she provided, helping people clarify their roles as EO officers and monitors and managers and staff related to areas of disability. And that was important for people understanding accessibility better. And then we had a smaller work group after that that went into more in-depth discussions with monitors, and you can imagine that that got technical. You know, that was where they really wanted to know how the rubber met the road. Following that, we went up to our DEI grant locations in Northern Virginia. We have 2 regions, and we specifically sent an invitation out. I personally called all of my partners and folks that I've known over the years to stress how important this training was, and that it was not a management training, it was not just a frontline training, it was training for everyone, and that we would have our different partners in the room with us. So when we went to conduct these trainings, we sat partners down, and some of these folks had met with each other, but more from a management standpoint. They really hadn't had the frontline, let's just sit and talk about 188, accessibility, accommodations, disclosure, all of those technical things that we always talk about when we're saying that everybody should know about these things. So anyway, we sat these folks down, and they really were engaged by it being interactive. They were engaged by the case scenarios that were provided, and they were also engaged, we have the DEI staff there, they were engaged by resources and tools and things that the DEI staff had been bringing to their local areas. And we told them that we were going to have them learn about strategies and resources to collaboratively serve customers with different backgrounds, abilities, and challenges in the spirit of WIOA. We were going to help them strengthen workforce partnerships to increase co-enrollments, and we were going to help them meet compliance requirements and enhance employment outcomes. People really like knowing that we could help them meet their compliance requirements. So, next slide, please. When we went and conducted the trainings, we focused on programmatic access because we heard from our disability resource coordinators and other staff members who said that staff do not always understand what does that mean. So we had to focus on that. We definitely focused on partnerships because Jamie said this earlier about things, you know, you need to have things set up ahead of time. You need to understand your partner's services. You need to know what tools and resources are available, not when the customer walks in the door and you go, oh, hold on a minute. You need to have those discussions ahead of time and be prepared. The other thing that we wanted to do was provide the AJC staff with empowerment because they don't always feel like they are empowered or know the right answers for things. So having these case scenarios and these I would call cross-pollinating discussions, it helped people say, oh, okay, well, that's a good idea. Well, I can do that. So it helped them look at things even in terms of accommodations and, you know, how they could step up with folks. And the last thing that we really focused on was disclosure. So how do you address a customer's presenting needs if a disability is disclosed? How do you engage other partners? And what services are available? And the other piece of this is really being able to describe other partners' program services to a customer and then asking them for their choice, would you like to be referred? So for example, if it turns out to be a customer with a disability and they find out whether or not they would like to be referred to voc rehab. And the other piece is to help staff recognize that sometimes customers they don't walk in the door saying, oh, I have a disability, can I get an accommodation? Usually they walk in saying, I have an illness or an injury, or I've had difficulty reading my whole life, and you need to be prepared as a staff, as a workforce professional, to be able to talk about what other supports and services and resources are available and how to access those resources in a timely manner. We can go to the next slide, please. And one thing to remember that I need to note here, as workforce professionals, we always need to refer to the regulations or the Civil Rights Center resources for specific guidance around disclosure. And I think that Jamie and others would tell you that's another whole training. We're just making sure that people know they need to really look at their guidance and follow that. And so I talked about the scenarios and the accommodations in a timely manner. Let me talk a little bit more about the partnership strategies and our integrated resource teams. This has been a strategy that we have been implementing since the first DEI round 1, and we have presented this at conferences. We talk about serving people with multiple barriers. And the thing I think that's important, this strategy is a service delivery one that strengthens and develops program services collaboration and delivers coordinated resources for job seekers who are facing multiple barriers to employment. And most importantly, this strategy enhances the power of partnerships at the local level and with a customer. And we've already talked a lot about our state level resources with partnerships. So most recently, the LEAD Center has provided Virginia with foundational information to implement Section 188, along with strategies and promising practices. We have learned that the ADA is consistent with Section 188, and we have engaged our state-level EO officers to work together to develop further trainings. And these trainings, initially provided last fall through DEI, were expanded statewide by the LEAD Center with funding from ODEP, and now has a focus on COVID-19. And we're fortunate that Virginia continues to be recognized by ETA and ODEP for our previous efforts. Thank you, and I'm going to turn this over to my colleague, Sylvia.
Hello, this is Sylvia. Thank you, Sinclair. I'm going to speak a little bit about teleworking as an accommodation, a benefit, and/or a mandate. I want you to keep in mind that the requirements of 188 do not change because of our current situation, because of the situation we have now with COVID. Telework may be a reasonable accommodation by itself. For example, an employee may have vision problems that would not allow them to drive at night because of changes in time, getting darker early in the fall, or the distance they have to travel from work to get into the job, which would require them to have a change in hours to start work, or either telework could be an option. Other accommodations could be a change in supervisory methods. The supervisor could give the employee written instructions. Also acquiring or modifying equipment like accessible workstation, software such as JAWS or Dragon, and accessible keyboard. Telework is not an employee right, but telework may be offered as an employment benefit based on the business needs of the agency. Agencies may offer telework as a means of supporting continuity, or to retain highly qualified employees, or to reduce congestion. Telework as an employee benefit may require different accommodations than working in the office. Telework may also be a mandatory condition of work. In those cases, the agencies generally supply everything the employee needs to perform the essential duties of their position. There continues to be accommodations needs for workforce professionals and job seekers with disabilities, and on multiple barriers to employment. Teleworking present for some employees is not considered a reasonable accommodation, but a benefit of employment. For others, though, it may be a reasonable accommodation, especially if you must work from home. I just want to give you a couple of scenarios dealing with the COVID situation and reasonable accommodations. In this scenario, the office has 3 employees that have had severe reactions to fumes in the office from cleaning products, such as disinfectants. The manager had to alert maintenance regarding the employees and had an air purifier placed in the office. The manager also advised the staff not to use cleaning products in the office and that cleaning would be facilitated by maintenance only. The 3 employees have reasonable accommodations in place because of their disabilities. And remember, we said 188 does not change because of the COVID condition. When the pandemic was declared, office staff became concerned about the spread of the disease and feared that they may become ill as a result. The other 10 staff members voiced their concern. The manager had several requests to telework from home. However, the manager stated only 5 of the positions could telework. To make matters worse, the staff began using bleach and other products with chlorine in the office space. Even with the purifier, the air was so strong with chlorophene, which relieved some of the staff's concern about COVID. But immediately, the 3 employees that were on the reasonable accommodation began to experience reactions that sent them home and to the doctors. The manager was now faced with a problem because she told the staff it was okay to use the bleach to clean their areas despite the disabilities of the other 3 staff members. The manager requested assistance from our office in allowing the staff to use bleach because the manager was in agreement that bleach should be used. Again, we've already pointed out that Section 188 still applies. This manager was told that the other 3 employees with the reasonable accommodations in place, they had to be complied with, and they could not change because of the current situation dealing with COVID. In another situation, an employee in a workforce center came into the manager and told them that a customer came in, needed assistance. The customer was coughing. So she asked, did she have to help the customer because she also had a disability and she felt like she was at threat or in danger. The manager told her to help the customer because the customer needed assistance because of the customer's disability. When we were contacted, we told them that both were still in place, Section 188, that the employee did not have to assist the customer based on the employee's disability. However, in just engaging and talking to the customer said they could continue doing their computer work at home, that they didn't need to do the work there in the office. So that kind of settled that matter for them. By engaging in conversation, they realized that it was not necessary to make the employee do something that they already had a reasonable accommodation for. And how can you engage your EO officer? Contact your EO officer, and you may come up with a plan of action. You may come up with training or whatever there is available to assist in providing reasonable accommodations, especially during this time. Thank you, and I'm going to turn this over to Rebecca.
Thank you so much to all 4 of our presenters, Jamie, Constance, and Claire, and Sylvia. That was just so much wonderful information. We wanted to share a few resources with you, and then I see that many questions have come in through the chat box, so we wanted to then turn it back to our presenters to respond to some of those. Jamie talked about the Section 188 Disability Reference Guide, Promising Practices in Achieving Non-Discrimination and Equal Opportunity. When you download this slide deck from leadcenter.org, these will be live links so that it'll take you right to the document, or you could just go to the Lead Center website. But it really is a wonderful resource that was years in the making. It gives you chapter and verse for Section 188, but within that are embedded links to best practices. So if you're wondering how to comply with different aspects of Section 188, it's an electronic, easy-to-use, user-friendly guide where you can find best practices that have been being implemented in different parts of the country, some of which are from Virginia. So I encourage you to look at that document and share it with your colleagues. As was mentioned, the LEAD Center has been working for several years in Virginia, and last year developed with them a system innovation brief that summarized some of the really promising things that they're doing, making change happen. Virginia's cross-system accessibility task force addresses equal opportunity and access, and there's also a leading to employment brief that LEAD Center put together that just kind of summarizes Section 188 that you might find useful. It's a short document to be able to share with colleagues who you may want to engage in this conversation. Jamie also mentioned as part of her presentation that it's very useful to use Section 188 as a lens as you're engaging your American Job Centers and WIOA workforce partners in AJC certification. And there's a 3-part webinar series that is posted on the LEAD Center website specifically focused on AJC certification and Section 188 with examples from a number of different states. So the workforce professionals from different systems actually are presenting how they use Section 188 in their AJC certification process. So again, we encourage you to look at those resources. And as with our other webinars, there are slides, recordings, and transcripts. So now we'd like to start with some questions that have come through for our presenters. And maybe I could start with Jamie. Jamie, given all of the systems in which you've worked, either as a staff member or providing technical assistance, why do you think Virginia's approach to engaging all of the systems together is so important?
Right. Well, I mean, I think I've seen some of the best efforts to improve access. They tend to happen in those local grassroots AJCs. You know, they're really doing the work. Building relationships, getting people to, you know, their employment goals. And the challenge is, how do you bring those efforts to scale, right? And I think the only way to do it is to really get the partners together, look in your state, who are the movers and shakers, who are the folks that really do promote collaboration and want to act on it, right? And I do think that buy-in from the state, and you know, Constance is a policy person, to have her at the table and hear from the disability partners informed her policy, you know, and so you really have to have the players come together, and also initiatives like the DEI that were so effective, but the problem was they stayed in their areas, they stayed there. How can you bring those folks up to a larger platform or bring people together for training and for discussions? And I think that's what Virginia's done.
No, that's great. And I think you're right. You know, you can really see how there's been a cross-system infrastructure being built over time through all of the efforts that were presented over the years with the systems working together. So thank you for sharing that. Constance, here's a question for you. Workforce staff and partners attend many different trainings, and it can be overwhelming at times. How can we motivate AJC managers, staff, and WIOA cross-title programs to attend trainings that are focused on accessibility?
Well, thank you. I think there's actually there's a 2-part answer to that. You have the carrot and the stick approach. By engaging our task force heavily in the AJC certification process, we had a little bit of a stick because of the compliance with certification component. But at the same time, at the state level, we were modeling partnership, and we were transferring that as we went out into the centers and did our site visits. And so we were encouraging that partnership at the local level and fostering the relationships as best we could from our state perspective. So there's that. It's also, we kind of had everything's caught fire kind of approach in Virginia, because once a few local areas have gotten their teeth into the value of the training, then they start talking amongst themselves, and it has spread, and now everyone wants to attend the training. we're getting hundreds and hundreds of participants at each training event, and that's saying a lot for us. We've also been encouraging through the task force. We've been it's been not just coming out from the task force, but it's also been coming down the individual pipes at the different agencies. So the Department of Ed member will be sharing, shares down her chain of command and says, hey, to her local people, they're doing this training. You should participate with your other local people. The Department of Social Services person is doing the same. The Title I, 2, 3, and 4 people are doing the same, that kind of thing. And so we're really encouraging it, not just from, the task force on high kind of perspective, but also across and through the agencies. And we really do have champions in every single agency involved in the AJCs. And I think that's been critical to our success.
No, that's great. Yeah, I'm sure that's very, very important to keep the motivation going. Thank you so much for that great answer. Sinclair, we have a question for you as well. It can be difficult to address attitudinal barriers in the workforce system, which can impact access to employment opportunities for people with disabilities. How has Virginia addressed that?
Thank you. Well, I want folks to know that we've been working on this for years, so it's not something that's happened overnight. And we've, through our partnerships and collaboration from the state level to the local level with consistent messages, we have been planting seeds. And it's part of what Constance just talked about. We've been bringing really good trainings, relevant trainings to the state and local levels on disability, and folks do talk among themselves, and I think that has helped. The other piece is we've promoted the integrated resource team strategy, and we have it had it included in our state plan. So now it's a piece of the fabric of how we're going to move forward, and I think that really helps for folks to understand that it's a helpful tool or strategy for people who face barriers to employment, not necessarily somebody just having a disability. And the DEI also became a disability resource, and we became known for promoting access for all job seekers and promoting systems alignment. And I think all of those pieces are all seeds that we've been planting along the way, and now we really, I think, are seeing some of this come to fruition where people say, I do want to go to that training. I do. That's important for our customers. And one of our folks in a training said, I thought I was uncomfortable asking about what accommodations someone might need, and now I understand why I do need to have that conversation, because I can go find helpful resources and tools or other services for that customer. Thank you.
No, that's great. That's really helpful. Thank you so much. Sylvia, here's one for you. Perhaps our AJCs and partner programs all have written accommodation policies. How do we work toward having effective processes in place so that staff know what to do when a customer self-discloses and expresses the need for more support and or resources?
Thank you. One of the things that we're doing in the Richmond office is we set up training modules for managers and for employees. It's a PowerPoint presentation that effectively goes over the entire policy for reasonable accommodations. We have one set for the managers and one set for the employees, and we ask them to email us once it's done. And one of the things that we reiterate with the management staff and employees is to have communication, how important communication is. And if an employee requests a reasonable accommodation and they haven't heard anything back in a minimum of 5 days, we've asked the employee to reach back out to the management official and let them know that they have an accommodation request in. Also, we reiterate to management that the worst thing they could do is not respond to a reasonable accommodation request, because no response is like saying, no, you're not going to get the accommodation, or to take a long time, that they should at least let them know, I'm working on it. Can you give me other examples of what would accommodate you in order to have you fulfill the essential duties of your position? The main key is communication, training, and also there's so many resources out there through our partners that if we don't have the answer, we can always go and try to get a resource or assistance for them. So training, communication is the key. Thank you.
No, that's great. Thank you so much. It's 4 o'clock. There were some other questions about whether or not the LEAD Center is developing best practices for people who may be dislocated workers because of COVID-19 and finding jobs, and questions about job accommodations, something that was called job crafting, which may be customized employment, and advice about disclosure. And I encourage people to go to www.leadcenter.org, and there's a tab called Customized Employment that has just really rich resources on how to customize jobs. Things have not changed now. I mean, being able to do good job development is really the same, and being able to accommodate people's disabilities, also is the same, as our speakers have talked about. But there are really good resources on the LEAD Center website. There's an Inclusive Career Pathways roadmap that gives you information on integrated resource teams and disclosure and other resources that have been mentioned here. I greatly want to thank our incredibly knowledgeable speakers today, and they brought so much experience and expertise to this discussion. So special thanks to Jamie, Constance, Sinclair, and Sylvia. Thank you to Melissa Turner for her welcome and overview before in the beginning of the webinar, and we hope that you'll subscribe to the LEAD Center listserv to find out about additional